Barry, erection difficulties are one of the most common problems for men, particularly as they age. Can you give us some figures on how many men experience erection difficulties?
Right. Men never talk about erection difficulties, even with their spouse or their doctor. But by age 40, about 90% of men have had at least one experience where they don't get an erection sufficient for intercourse. By age 50, about 50% of men have some erectile anxiety. And it is the major cause of inhibited desire and stopping being sexual. So about a third of men stop being sexual between 60 and 65, two-thirds between 70 and 75. And the major cause is they're in a negative cycle of anticipatory anxiety, performance anxiety, seeing intercourse as a pass-fail test, and feeling embarrassed, frustrated, and avoidant.
Yeah. And of course the most common treatment for erectile difficulty is Viagra and Cialis.
And what I would argue is I'm very pro erection medication and for some couples using injections. But it can't be a standalone intervention. You can't just give the man the drug and expect it to do everything. So the question becomes how you integrate a pro-erection medication into their couple style of intimacy, pleasuring, and eroticism. The other thing that is absolutely crucial is what we talk about as a good enough sex model. That rather than, like in your teens and 20s, every experience flowing to intercourse, that often what will happen is 85% of the experiences will flow to intercourse. But when they don't flow to intercourse, the man in the couple being comfortable with either a sensual backup scenario or erotic non-intercourse backup scenario, the worst thing the man does is he apologizes and he feels that he's failed, rather than accepting that it can be an enjoyable, mutual, or asynchronous sexual experience.
So when you say asynchronous, what do you mean by that?
Well, what I mean by that is everybody prefers a mutual synchronous experience where both the man and the woman feel desire, they feel pleasure, they feel eroticism, and they feel satisfied. But often the sex is better for one partner than the other. And often for couples before 40, it's better for the man than the woman. But I think what happens in your 50s, 60s, 70s, and 80s is that often the experience, whether it's intercourse or non-intercourse, is still going to be better for one, but not at the expense of the other. And the best example of that is using erotic non-intercourse sex to orgasm, where it might be better for the woman than the man, but the man can also enjoy it.
Great. Now you were saying yesterday that Viagra has been responsible for more problems with erections difficulties than it has solved. Can you tell us a little bit more about that?
That's really distressing, but I think it's true. And the reason is not because it's not a good drug. I think both Viagra and Cialis are excellent drugs. I think for many couples, it's easier to integrate Cialis. But you can't ask the medication to do it all. That ultimately sex is a team sport. They need each other, and the woman's active involvement is really, really important. And that's why couple sex therapy is so much better than seeing the man alone or the physician just giving the man Viagra.